Okay, it says I wasn't connected, but I think I am connected now. So it's Friday. It's time for our Lunch and Learn. And today, by special request, we are going to be talking about sundowners as that relates to dementia. So I know we have been talking a whole lot about dementia for the last 2 or 3 months, different angle every week. But today we're going to be talking about sundowners and what that is and what you can do about it. And we'll see how we go. Now, for those of you that don't know, this is a subject very near to my heart because we are dealing with this in our own family. And so when you have people in your family that you know and love and they are having memory issues, it's very, very debilitating, not only for them, but also for the family. And so when you have dementia, whether it's with Alzheimer's or Parkinson's or just dementia, Lewy body dementia, whatever, you still can have this sundowner effect. So basically, what this means is that the human brain has to work hard. We know that we do work hard. But when we have the dementia, the human brain works just a little bit harder all day long. So as the sun starts going down, the brain goes, oh, I'm done, I'm checking out. And so, that's kind of in broad terms what that means. So as the sun goes down, as it becomes late afternoon and it gets less bright, then the people that are having the memory issues, then they start to feel even more confused, more agitated, and they just have some problems with their behavior. So that's what we want to talk about, and what can we do to help them. And they call it their sundowning because they're correlating it with the sun going down. Now, I think that's a little oversimplistic. There's a lot more things going on in the brain. We're going to give you a supplement that can help if somebody that you know is dealing with cognitive issues. But even if it's just you and you want to keep your brain sharp and that kind of thing, then we want to talk about that. So when it is connected to late afternoon, the patients get more confusion, more anxiety, more agitation, more pacing, and more shadowing of others. They want to be close to somebody because they're afraid because it's getting dark, okay? So each person is different. Each personality is different. So how this is going to show up is different. So we all interpret the world via the information that enters our brain through our 5 senses. Chief among these is sight and sound. Imagine the difficulty that you would be in if you could not see, if you could not hear, then, everything would just be kind of a blur because you can't do a whole lot when you can't see. Even in the early morning when I get up, and I always get up before the sun rises, maybe not on the weekends, but a lot of times, yes. And so I'm at my kitchen table overlooking, out into the wild blue yonder, and it's dark. And so as the sun comes up, I'm able to see better. I have to turn on the lights when I get up because I do not like the dark. I don't like being in the dark. So people with memory issues have sensory input deprivation. And so as the sun goes down, as the rooms get darker, then they're going to have more issues. In my case, our family member for years has sat in a dark room. Now, it wasn't completely dark like in my office where I am right now. There are no windows. And so if you turned off the lights here, I would be in absolute total darkness. With our family member, there were windows all around, so there was always some light coming in, but most of the, for the most part, darkness was preferred. Even now, because we have this person in a memory care facility, lights want to be off. No, can't turn off the lights. We keep the lights on. But all of the people that are in there, they want the lights to be down because it's just easier. Their brain doesn't have to work as hard, and that's not conducive to maintaining whatever brain function that you have. So we've all heard that we only use a fraction of our brain. And while that might not be true, we all have more brain power than we are using, all right? So a cognitive reserve can be brought to bear when we're faced with complex and stressful tasks that requires more mental effort. But people with memory issues, such as Alzheimer's disease, they use up their cognitive reserve for as many as 30 years okay, before the onset of the disease. During that time, in simple terms, the condition eats away at their cognitive reserve. It is only when the damage is so significant that our brains can no longer compensate for it that we develop the first symptoms of dementia disease, Parkinson's disease, or any other kind of dementia. So by the time somebody comes up with a symptom, they are, or they have been dealing with this for as long as 30 years, but you've never noticed it because there was always extra brain power to compensate for that. And the symptoms were not apparent, but now they are. So this is why it seems like it's really, really quick. And it's not all that quick. It's been going on for a long time. We just haven't noticed it. All right. We have all felt cognitively exhausted, run down, and irritable after a long day doing a difficult task that has required an extreme amount of effort and concentration. Those living with dementia are required to exert similar amounts of mental effort just to get through their routine. So it's no surprise that after several hours of concentrated manual or mental effort just to get through the day, people tend to become cognitively exhausted. So the homes of people living with dementia should be well lit into the late afternoon and evenings when the sun is going down to help the person with dementia integrate and interpret sensory output. A short nap after lunch may help alleviate the cognitive fatigue towards the end of the day. And this is one thing that we see is that older people that are having memory issues, they do like to nap a lot. And that's not just because they're lazy, it's because they have used so much of their brain power and they have so little reserves left that they are absolutely exhausted. And so you don't want them to sleep late into the afternoon because then it's going to mess up their sleep-wake cycle. But a short nap after lunch is not necessarily a bad thing, and it can help them recharge. All right? So unmet needs such as hunger or thirst, the presence of pain, depression, boredom, and loneliness can all contribute, right? So we need to know that our older people are having the nutrition that they need. And in our case, nutrition was a big deal. People get older, they don't want to cook, they just want something easy. So it's a pack of M&Ms, or it's a bag of Oreos, or it's a PB&J, and I'm not knocking those foods, from time to time. But if that is our only meal substance, there's no protein in that. There's all sugar in that. Sugar feeds dementia. So we don't want to do that. And so on our particular family person went in the hospital in July of 2024. And in the note, it says metabolic cognitive decline. What does that mean? That means poor nutrition. Poor nutrition. So poor nutrition can absolutely set somebody off into dementia. And so we don't want to do that. So we know that with Parkinson's disease is something that is characterized by, we call it the bobble. Okay, you've got somebody and they're just kind of bobbing along, or they're shaking and trembling and that kind of thing, right? So it's known to affect balance, movement, and coordination. And sometimes Parkinson's people develop dementia as well. According to the Wheel Institute for Neurosciences Memory and Aging Center, most people with Parkinson's start experiencing movement symptoms when they are between 50 and 85 years old, although some can show it earlier. Dr. Isabella Park, who is the Associate Medical Director and Director of Geriatrics and Palliative Care at Long Island Jewish Forest Hills, which is part of the Northwell Health in New York, said that the majority of patients in Parkinson's disease will develop dementia, and those who do are at higher risk of experiencing sundowners. Now, sundowning can happen at any stage of dementia, but it's more common in the middle and latter stages. So these symptoms include insomnia, anxiety, pacing, hallucinations, paranoia, confusion, irritability, and screaming. Okay, so if any of these are affecting any of your older family members, then you might be dealing with dementia, even though it's not the full-blown, I don't remember who I am, I don't remember who you are, and that kind of thing. So in our own case, family members are still recognized. The person still knows their own identity, so it hasn't progressed to that point. But there can be some of these other symptoms that are in there, and so we want to make sure that we can do what we can nutritionally so that we can stop this. So sundowning can cause different behaviors in varying degrees. It can start out subtle and then increase if not redirected, or if the sleep pattern is not corrected. And this is one thing that we know from our own personal experience, is that when insomnia is not dealt with, we don't want to give too much medication, we think we're giving enough medication, but there's still no sleeping, they get into this negative feedback loop where they just can't sleep. And after 2 or 3 days of sleeplessness, then all of these, the mania, the agitation, the screaming, all of this is just exacerbated because the poor person hasn't had any sleep. So sleep management is absolutely key for your loved one to help them through this difficult time. So up to 80% of Parkinson's patients develop dementia. The average time from onset of movement disorder to the problem of dementia is about 10 years. Now, I did read a report that said if you were diagnosed with dementia after 80 years old, your lifespan was probably about 3 years. So, that's kind of a sobering thought when those kind of things are going on, because nobody wants to think that they're going to go through life without their person. But, these things do happen. So the exact reason or cause of sundowners is complex and poorly understood, but it's thought to be a disruption of the biological clock caused by dementia. So Dr. Parks explains that it could be triggered by various things other than being just tired. It could be because you're hungry. It could be because you're bored. It could be because of sleep deprivation, which we talked about a while ago, medication side effects, physical illness, pain, and dehydration. And one of the things that as we get older, we lose the thirst reflex. That's just part of getting older. We don't feel thirsty, so we don't go and get something to drink. And so I make sure that I always have a glass of water close by. And even if I don't think I'm thirsty, I make myself drink, because I know that part of getting older is you get dehydrated, and we don't want to do that, okay? So here are some practical tips in helping someone that with dementia that is related to sundowning. So first of all, you have to establish a regular routine, all right? People with dementia, their internal clock is off, and they want to sleep all the time. All right, by establishing a regular routine, we can regulate the body's internal clock, making it easier to manage sundowning. People living with sundowning should wake up and go to bed at the same time each day, eat meals at regular times, and schedule their activities and rest periods throughout the day. A 2019 study concluded that a lack of routine may cause symptoms of depression in older adults. Depression has been found to aggravate pre-existing conditions that are cognitively related. So as we get older, one of the things that happens, I'm obviously not retired because here I am talking to you, but one of the things with retired people, they've got nothing to do. They didn't have a plan B, they're not working, so they're just home, they're home alone, maybe they're home with their spouse, but they're just home. They've got nothing to contribute. They do, but they're not doing anything to contribute. And so they feel depressed. They don't have a schedule. It's like, well, who cares? Because I'm just here. I'm just all by myself. So this is one thing with our older people, that we can make sure that they have a regular schedule so they don't get into that depression, because that depression exacerbates the dementia. Creating a calm environment. According to a review and psychiatry investigation, sundowning can be triggered by overstimulation. So it is important to create a calm and relaxing environment. Some ways to do this is by reducing noise levels and eliminating distractions that can cause anxiety or confusion. Any calming alternative methods such as essential oils, massage, healing touch can ease anxiety and stress for that person, according to Dr. Park. Relaxation techniques such as meditation and visualization can help reduce anxiety and promote relaxation. In a recent randomized clinical trial, they found that mindfulness meditation appeared to be feasible and promising strategy for maintaining or managing depressive symptoms and maintaining emotional stability, significantly benefiting cognitive performance. Now, what actually is mindful meditation? Well, there's all kinds of ways that you can do this. I don't want, and most of my audience is devout Christian. I am too. I own that 100%. When devout Christians can hear the term meditation, they will think New Age. They will think this is not Christian. They will think, whatever they think. I will just tell you that the Bible is very, very full of instructions on meditating, but they call it prayer, okay? When God says to Abraham, go out and look at the sky, right? Count the stars. This is how many kids you're going to have. God gave Abraham a picture to meditate on, to think on what God was going to do for him. And so when you're giving older people guided meditation, which can be in the form of prayer, it can be in the form of affirmations. Look, you're doing so much better today. Let's go do some crafts today because you're going to feel better. All those kind of things help with the cognition, and it prevents these symptoms from getting worse, okay? Exercise is an essential component for people with dementia. Now, we know old people do not like to move. They don't want to exercise, their joints hurt, all that kind of thing. So we know from this report that regular exercising will improve sleep quality and reduce sundowning symptoms. A large study from the Parkinson's Foundation showed that people with Parkinson's who start exercising earlier in their disease for at least 2.5 hours per week experience a slowed decline in the quality of life compared to those who start out later in the disease. Establishing early exercise habits is essential for overall disease management. Now, this would be for any dementia. Now, 2.5 hours over 7 days is not that much, guys, all right? And it doesn't have to be running around the block. I don't know many seniors who could do that. I'm sure, well, my husband, he could do that. I don't know that I could do that. But there are things that you can do. You can exercise, you can lift weights, you can do circuit training, you can do all kinds of things, even just walking, right? Just walking tones your core, and it gets you outside, it gets you into another environment that is going to help your brain see things differently, and so that's really important. The Parkinson's Foundation recommends that people with dementia should have aerobic activity, strength training, balance, agility, multitasking, and flexibility. Now, they also recommend that you limit caffeine and alcohol, which I think that is a really, really good idea, especially with someone who's having memory issues. They also want to make sure that you cut out the sugar. Sugar is not a great thing. Now, dementia in some places is known as type 3 diabetes. Now, we know that diabetes in the body, whether type 1 or type 2, you've got to make sure that you are managing your sugar properly. Well, when you've got dementia, they are saying that that is like having diabetes in the brain, right? And so part of that is because your body, your brain, for some reason, and I'm not going to get into all of that, does not process glucose anymore. It just doesn't. This is why the studies that show when your person is having dementia, one of the tests that they give you is they give you a piece of paper and they tell you to draw a clock. People with dementia can't do that. Their clock looks, like a Picasso painting. It just doesn't look right. However, they have found that you give that same patient, I think it's 3 tablespoons of coconut oil, which is sweet. I don't know if you've ever used coconut oil to cook with, but it is sweet. You give that patient 3 tablespoons of coconut oil. In about 3 weeks, that patient can make that clock look the way the clock's supposed to. Now, why is that? Because the brain has stopped using sugar. The medium-chain fatty acids in the coconut oil is a sugar that the brain can use, and so it helps retard that dementia. So that's just something that you need to know that you can do with your person. No alcohol, no caffeine, no sugar, okay? Caffeine and alcohol disrupt the sleep patterns, and when people that have dementia are not sleeping properly, it exacerbates their symptoms of sundowning. Limit caffeine to a morning cup of coffee, and alcohol should be avoided all the time. It causes confusion and it causes anxiety. So there are some herbs and supplements that are helpful. Chamomile, melatonin, vitamins B, C, and E are shown to calm and lessen sundowning symptoms. Research suggests that taking melatonin, which is a naturally occurring hormone that makes us sleepy, alone or with exposure to bright light during the day could help ease sundowning. And a 2014 review found that melatonin could help reduce the agitation at night and improve sleep with people with dementia. A randomized controlled trial found that chamomile extract significantly improves sleep quality among elderly people, and it is a safe way to promote healthy sleep. This can prevent the sleep problems that go along with dementia. Low levels of vitamin D are often observed in patients with dementia, and supplementation has been shown to improve memory and slow the progression of brain atrophy. Now, atrophy means slow death, right? It can be fast death, but basically it's slow death. And so when you are having memory problems, your brain is shutting down because you've used up all that cognitive reserve and it's working hard and you're just tired, and a lot of it is because of malnutrition. There is another research study that showed vitamin C deficiency impairs cognition, and also supplementing with vitamin E has protective action against Parkinson's. So one of the things I want to show you is this little product. It's called Age Lock Youth. I love this. And it is a vitamin, and it has vitamin D, K2, it's got your omegas, it's got all of your bioflavonoids, right? It's got alpha lipoic acid, it's got quercetin, which is from vitamin C, and it also has resveratrol and different things. It goes into the mitochondria and causes a reverse in the aging system. Something else I like is this. This is a sample pack. It's called Mind Bloom. Now this is a Green Compass. It's a Green Compass product, and I like it. I'm going to show you what it has in it. Ta-da! It's got all these medicinal mushrooms, right? It's clinically trialed, so we know that there's a lot of science behind it. It's got sage as an extract, which is clinically shown to boost memory and cognition in as little as 10 minutes, right? So if you are dealing with someone that has dementia, what is going? Memory. They don't have memory. And so the sage in this is to boost the memory. It also has cordyceps mushroom, okay, which features neuroprotective compounds that support memory and provide protection against free radicals. And so this is something that we need, okay? Cordyceps is something that we know. It promotes mental focus and clarity. It also stimulates nerve factor in the brain. That means it regrows things that have atrophied in the brain, and this is going to go a long way when you have people that have cognitive impairment. It also has organic full-spectrum lion's mane mushrooms that can bolster cognitive health through the support of tissue growth, repair, and maintenance. So this is a really, really, really good product. I highly recommend it. It encourages mental focus and clarity, and it supports long-term cognitive brain health. There is some research here. Let me grab my other paper. It says that the benefits in focus can happen in as little as 10 minutes. It promotes long-term cognitive function. It helps maintain focus and concentration, and it supports brain health and memory. And these are all the things that we're dealing with when we are dealing with dementia. So this is really, really good. Any kind of multivitamin that has all the antioxidants in it is very, very good, because the antioxidants are made from your fruits and vegetables, and this is where your vitamins come from. And you're going to see, look at that color, right? Purple, my favorite color. This is full of antioxidants that's going to go into the body and cause any kind of malnourishment not to be bringing the body down and bringing the cognitive state down. And so what we want to do is we want to make sure that what we are doing is helping our people, and we want to know that it is almost always nutrition. Older people are tired. They have not been taking care of themselves. They don't want to cook. They don't want to eat. They want their cookies. They want their cookies and their Coke. And there's nothing wrong with cookies and Coke, at the right appropriate time. But when that's all that you're consuming, you don't have any proteins, you don't have any fats. Fats feed your brain. That's why that coconut oil, medium chain fatty acids, that's why it goes right into the brain and helps reverse some of that cognitive dementia there. So we don't know why people get dementia. Hopefully I get to pass on that. I do a lot of things right now to make sure that my body is healthy, to make sure that I have a lot of antioxidants so that I can come against the oxidative stress. All right, because the oxidative stress is what is the rust in any part of our body, whether it's in our muscles, our bones, our organs, or our brain. We've got to have those bioflavonoids in order to combat that. So you've got lots of strategies: good nutrition, good multi-mineral, multivitamin, and things like this Vine Bloom that's created just for cognition. I know that in one of the papers it says that it increases the BDNF. Okay, so that is part of what's in your brain that makes you able to pay attention and focus and do all the things that you need to do. That's a lot. That's a lot of things that we can do for our person. Now the problem is getting them to comply. All right, people with dementia are pretty much rigid. They want to do what they want to do. They don't want to do anything new. So getting them to comply is a little bit difficult. So for you who are not in that situation yet, get your vitamins, get your bioflavonoids, get your mushrooms, do all the things that you can do so that you can preserve your cognition while you still have it. So it is the weekend, and one of the things that we always make sure that we do on the weekend is we relax, we restore, we rejuvenate, because we know Monday's coming and we've got to do it all again. And that's a good thing. So think about what you can do to preserve your own mental cognition. And I will see you again next week. Thank you for liking. Thank you for sharing. Thank you for asking questions. And I will see you next Friday.